All yours.
Thank you. Welcome, everybody. Are y'all from around here? Yeah? Anybody from not around here? Oh, where are you from? Minnesota. Okay, awesome. We're from Tennessee. So we didn't come as far as you did, but that's quite a distance. Thank you for coming. Did you come here just for this? Okay. Okay. Ah. Well, thank you for coming, and thank you all for coming. I'm very honored to be here. Thank you to Prep and Ready for having me here. I really do appreciate it. This is the actually two classes. I usually teach how to use herbs medicinally, and I also teach another class that is herbal first aid. So you're actually getting 2 for 1. These are going to be combined today. So you're getting a good deal here. I am known as the Weed Doc. And let me get to the next slide here. I'll tell you a little bit about myself. Oh, I got to turn it on first. That's probably why it's not working. It is recording on the phone. Can you not hear me very well? Okay. He's got a microphone. He'll go get that and we'll get that set up. I am the Weed Doc, and I have 2 separate different cards here. They are sitting up here, so afterwards, if you want my card, you can come up here and grab that if you want to. This white card here is specifically about myself, and it's got all kinds of my information, everything that's on there. If you have questions, feel free to email me anytime, even if it's a couple years down the road. If you've got a question, I'm happy to help. Just let me know. I have another card here. This is specifically for the farm that I have. My husband and I, we are homesteaders, and we're trying to be very self-sufficient. So we do a lot of YouTube videos and things like that. So you can go to our YouTube channel and kind of see everything that we do there. It's called SHTF, Survival Homestead Teaching Farm, if anybody is interested in that. And he is getting that set up. While he's doing that, let me let you know that if you are interested in learning herbs from myself, I do send out an email every couple of times a month, bi-monthly. And if you want to sign up for that, you can go to my website, which is www.theweeddoc.net. Now, keep in mind that is not .com, it's .net. It is, yes, yes. And it's on my cards, and it's also on the very last slide I've got. So, yeah. And that's what it looks like. This is the picture of it, so you can go there. Or if you prefer, I do have a sign-up sheet. I can just manually put you in if you just want to put your email address down. So I've got a sign-up sheet over here for that. I have a bunch of books, and you guys will be getting this book since you signed up for this class. And it is the best one, I have to say. It's got everything in it. Everything that we're going to talk about, how to make a tincture, how to make an herbal oil, tea, all that, thank you, is in there. And it takes you step by step. Let me get this on here. Can everybody hear me? Is that better? Okay. I'm sorry, my voice does not carry very well. Thankfully, we have a mic. And I also have these other books available. Also, if you're interested in those, I do a lot of animal care. I do that on my own animals on our farm. We have goats and ducks and meat rabbits and all that. Let me go to the next slide here. Oh, that went backwards. This is my disclaimer, just saying, go to your own medical doctor and talk to them before consuming any herbs. And just, my husband's an attorney, so he's like, you got to put that in there. Yes. I didn't say that. All right. Who knows who John D. Rockefeller is? Money. Yeah. Money, yes. He used to be, he's already dead and gone now, but he made it big in the oil industry. He made a lot of money in the oil industry. But a lot of people don't realize he also has made a lot of money in the pharmaceutical realm. John D. Rockefeller. This is a little bit of history on herbs. You know, scientists were doing groundbreaking work to understand health back in the early 1900s. Vitamins were being discovered. People were understanding, the scientists were understanding that the vitamins, you have a lot of deficiencies, and so vitamins would take care of that. You've heard of vitamin C and scurvy. You know, things were like they were being made back then, just starting to come on the scene in the early 1900s. And so Rockefeller was smart enough to think ahead and think from a business standpoint and think, okay, I need to get on top of this. He saw this as a big opportunity to make even more money. He'd already had a lot of money, but he didn't have enough, according to him. He saw this as an opportunity because the pharmaceuticals, any kind of vitamins, pharmaceuticals, they could be patented and then they could be sold for high profits. So that was a way for him to make some more money. So the big problem that he was having, though, was that he came across this obstacle of everybody knew herbs back then. Everybody used herbs as medicine because that's what God put on this earth for us to use as medicine. And so everybody was using herbs. Medical doctors at that time, they were being trained to use herbs for their patients. This obstacle that he was coming up against, he had to think about this. He went to Congress. He submitted a report to Congress, and unfortunately, they accepted it. In this report, he said there were too many doctors and too many medical schools in the United States. He also said, and this is his words, anything natural is unscientific quackery. Anything natural. That right there changed the course of everything. That is why we are today in this pharmaceutical war that we're in. So Rockefeller began finding, because this report went through, he began funding all the medical schools in America on the strict condition that they only taught allopathic medicine. Now, allopathic medicine is what we know of today for medical doctors, you know, the Western medical world. And because of this, everything has changed. Everything has changed. Medicine's definition, you know, after all this, the definition became a process of prescribed patented drugs. So when you go to a doctor, they will treat you with pharmaceutical medications. It's just another way for them to pack their pockets, you know. The mindset of all Americans became a pill for an ill, unfortunately. So there's a lot of things in the world now as far as natural medicine that it's just not right. Did you know that there are 3 states in the United States that will not allow natural medicine in their states? I feel like it's you should have your option. If you want to go natural to a medical doctor, you go to a medical doctor or a naturopathic doctor or functional medicine or whoever you choose, I think that should be your option, right? Tennessee, South Carolina, and Florida. Yeah. I'm from Tennessee. I'm a naturopathic physician. I cannot practice in Tennessee. It is illegal. Yes. Yes. Anybody, anything, any kind of natural medicine is illegal, unfortunately. Yeah. Yeah. And I love educating. So this is up my realm right here. I love educating other people. A lot of people, you know, it's medicine is pharmaceuticals, I should say, are sort of more it's kind of new on the scene. You know, hundreds of years ago, herbs were it. And pharmaceuticals have only been around for about 100 years, a little over 100 years. What if there is not a medical doctor to call? What are you going to do? What if your cell phone doesn't work? What if you are in a Hurricane Helene like we were and something catastrophic happens? You're not able to get to your pharmacy, to your medical doctor. What are you going to do? You need to have this herbal knowledge so that you will know what to do. Not just for yourself, but for your family, for your animals, because you can use herbs on your animals as well. Now, let me make it very clear. There is a place for pharmaceuticals. There are some pharmaceuticals that are needed. You know, it can save people's lives. But for most things, I would say 99% of things, let's say blood pressure, gout, cholesterol, uh, gastrointestinal, respiratory, anything like that, herbs can help you with those things. They can not only treat you, but they can prevent these issues from happening to begin with. With herbal knowledge, you can prevent and treat things. So let's talk about just a little bit of general information about herbs. Many weeds are medicinal. That's why I go by the weed doc, because a lot of the weeds that are in your yard are medicinal. It's things that you just it's obnoxious and you want to get rid of, but actually they're really good for you. You can have a pharmacy in your yard and not even realize it. A lot of herbs are perennial, so if you plant them one time, minus the weeds, if you plant them one time, they'll just keep coming back year after year. And you can have a pharmacy just right outside your door. Wouldn't that be nice just to be able to walk outside and be like, okay, I've got some joint issues, let me take this. Or I've got this issue, I'll just take this. Instead of having to go to a pharmacy where there are toxic chemicals within that pharmaceutical medication. Now, herbs do have a shelf life. If you grow herbs yourself, you can expect a shelf life of about 2 years if you dry them correctly. If you purchase them, even if it has an expiration date on it, I would give that only about a year shelf life. Now, I really like the homegrown herbalist school, homegrown herbalist if you want to purchase herbs. I like them just because I know how they package the herbs and I know how they dry the herbs. Look at the difference here. This is from the homegrown herbalist. This is another company here. Clear packaging. And this is actually, it comes in a plastic bag inside of this mylar, kind of like a mylar bag. So no light's penetrating it. And also, if you dry herbs, you should never, ever, ever go above 110 degrees. This company here, Homegrown Herbalist, I highly recommend. I use these myself. I have ordered hundreds of herbs from them. So much so that I became an affiliate for them. And I promise you I'd still be saying this even if I wasn't an affiliate. But they're great. They're great. They do not dry the herbs over 110 degrees. Yes. Yes, they do not come fresh. Yeah, they come dried. Yeah. Now, if you want to save a lot of money, grow them yourself. But there's a lot of things that you use the roots for. So that's what I like to buy a lot from them is the roots, because I don't like to grow something and have to dig up the roots and kill the plant, you know. But I recommend them. They also have a school there if you're really interested in in-depth learning of herbs. Highly, highly recommend it. It is on both of my cards here if you're interested in it. It's great. It's okay. I'll tell you, I went through an associate degree, bachelor's degree, master's degree, and doctorate. All of those things. I never learned herbs the way that I learned when I went through this school. I have personally went through this school, and it is amazing. It really, really is. If you are interested in that, contact me. I'll tell you everything that you need to know. Highly recommend that. If you're going to do that, let me give you just a little tip. It's lifetime access. So if you're going to sign up for it in like a child's name or something. That way you get access to it and they get access to it all their life. So don't tell them I told you that though. All right. So you can use herbs internally, obviously, and you can use them externally on your skin. There are some apps available, and they're written down here. If you have some unknown plants in your yard and you want to know what they are, these are some free apps that you can go to, and you take a picture, and it will tell you what it is. But I would not go by this 100%. Just go do one, do another one, do another, and cross-reference. Go to my book where you've got in front of you. It's got all kinds of pictures. It has a description of the plants and everything. Make sure you have the actual herb, because there are some lookalikes, toxic lookalikes, unfortunately. Now you can freeze dry herbs. The only problem with freeze drying, who has a freeze dryer here? One? Okay. If you freeze dry, you got to make sure it doesn't go over that 110-degree mark. If it goes over 110 degrees, it kills those the medicinal benefits of the herb. So you got to make sure you don't go over 110 degrees. But you can see Melinda has brought some here. You can see the difference. Here's some yarrow. Difference between fresh and freeze dried. You can see that. I mean, it preserves things really well. A freeze dryer will preserve if you keep it under 110 degrees. Freeze dry? Yes. Yeah. You can freeze dry, and it will preserve it for a really long time, 20, 30 years. So yeah, it's always a good thing. That is if you're going to have dried herbs on your shelf. Now, if you're going to keep them on your shelf, make sure that you keep them in a clean, dark, dry area. Something that's kind of in a cooler area. You can keep them in a jar like this. It's got to be amber. Now, you see a lot of the blue jars. Don't use that. Light can penetrate through that. This right here, they're really good. The amber jars. You can use any type of amber jar, or if you just want to keep them in the dark in a cupboard somewhere behind a door. Yes, ma'am.
So if you dry them naturally, like air drying,
yes,
freeze drying, the shelf life on the air drying is 2 years, and the shelf life on the other is 30. If you put them in a Mylar bag with an oxygen for the freeze dried.
There you go. Yes.
It has to be in a Mylar bag with an oxygen absorber. Open the bag. Once you open the bag, you've got a year to on it as well. So what about, like, those where they suck out all the air again?
Yes.
Can you do that? Like, once you open it, right? Now you say it only lasts like. But then you take all the air out again. You suck out all the air.
You could do that, but make sure you put more oxygen and a moisture absorber in there.
You just have to replace the oxygen absorber every time you open it if you want to reseal it.
Yeah.
Okay.
Yeah. So some herbs need to be dried depending on how you use them. Now, if you're going to make a tea, you can use fresh herbs. If you're going to make, let's say, a tincture, you've got to have dry herbs, dried. They cannot have any moisture when you're making an herbal oil, tincture. I'm sorry? We will get to that. I'm going to show you exactly how to make all of that. Yeah, no problem. A tincture, we'll get to that. So if you're going to dry these, do them in a freeze dryer, put them in a dehydrator, or you can air dry them. If you're going to use a dehydrator, make sure that it stays below the 110-degree mark. Go as low as you possibly can, and if it has an option where it has no heat, use that. Just use the fan. Yes, ma'am.
Freeze dryer and dehydrator.
No, it is two totally different things. Actually, Melinda has a freeze dryer here. It's very large. It's much bigger than a dehydrator and much more expensive than a dehydrator. Yeah.
You have to freeze dry it first and then dehydrate?
No. It's two separate things. Yeah. Dehydrators, they'll take most of the moisture out, but not all. A freeze dryer will take 99.9% of everything out, all the moisture.
One or the other.
Yeah. Another thing, a difference about the freeze dryer and the dehydrator, not necessarily herb wise, but in food wise. The freeze dryer preserves most of the nutrients that you need in your food, where the dehydrator will remove not a lot, but it will remove, like, if you want the nutrients part of it for like survival mode, freeze drying is best, always best, because it preserves most of the nutrients that you need in your food. So that's one of the differences too. But yeah, dehydrating is certainly way to go for herbs.
Yeah. Now, if you are going to dry herbs yourself and not purchase them and dry them yourself, it's best to go ahead and make sure to powder those. But if you're going to powder them, wait until right before you use them. If you powder them prior to that, it just shortens the shelf life a little bit. So just make sure you do that. I'm going to turn this on while we are talking. So, I went the wrong way. General dosage guidelines. Here we go. This is just something general to go by. If you are feverishly writing this down, don't worry. If you want me to send this to you, I'll be happy to do that. Just email me and let me know. But this is for maintenance issues. If you are taking, let's say you're taking fresh herbs and you're just going to be consuming those, usual dose is about 2 to 4 teaspoons for an adult, 2 to 3 times a day. Now, if you have an acute issue going on, go ahead and take that more frequently. Yes. Let's say that example for that would be if you have an acute issue, you would take the usual dosage of 2 to 4 teaspoons 5 or 6 times a day instead of the 2 to 3 times a day. Is that understood? Okay. So I have to warn you, the next slides are pretty graphic because there are wound images. These are of actual people. And these are the things that we're going to be talking about. We're going to be talking about burns, bleeding, infections, wounds, pain, shock, poison, and asthma. But along with this, we're also going to be talking the modes of transportation. You could take fresh or powdered herbs, make an herbal tea, an herbal oil, make a salve, a poultice, a tincture, and we're going to be talking about all of those things. Now, a lot of people get confused when they see herbal oil, internal and external, and with a tincture, internal and external. Herbal oils, if you take an herbal oil, you can consume that internally, let's say in foods, or if you do oil pulling. Do you know what oil pulling is? Anybody do not know? Okay. You can make an herbal oil, usually with coconut oil, and oil pull with your teeth. And of course, you can make it and you can rub it on your skin. Now, with a tincture, they make a spray top tincture. I will get more into this a little bit later, but they make a spray top where you can spray this on. So you can use it topically and internally, both. All right, let's talk about burns. There are 3 different types: first degree, second degree, and third degree. The first degree is right on the very top of your skin. That's the epidermis. That's usually like a sunburn, things like that. Now, if it's a little bit deeper, it goes into a second degree burn. And of course, third degree is pretty severe. What we're going to be discussing is more for first degree or second degree. If it's third degree, you need to get immediate help because they usually often will require skin grafts. All right, so this is Jill. This is baby Jill. And Jill, she had second degree burns. Unfortunately, her parents, they were in a domestic dispute, and the mother was wanting to take the child away, but the father wouldn't let her. And so, unfortunately, he threw boiling water on the baby. And because the mother wasn't able to leave and get away, she had to have that herbal knowledge to know what to do for her baby. So she was able to make a poultice. She knew to make a poultice. She knew what herbs to use to make a poultice. And she put this on her baby. And now you can see the before and after. Her burn scars are barely visible. Now, here are some of the herbs that are really great for burns. Aloe vera. Most people know aloe vera is really great for burns. This is aloe vera here. This is just one that I've pulled off. Now, what you would do is you would slice it open like this. And inside here is all this really good gel. Can you kind of see that little gel that's popping up there? That's really good for burns. Put that on burns. Now, you can also use hens and chicks, purslane, prickly pear, cactus, calendula flowers, which I have some right here. That's what calendula is. Those are the petals there. And plantain and manuka honey. Now, it can be any type of honey. It doesn't have to be specifically manuka, but manuka is really good for the skin. Now, I'll draw your attention right here to the pictures here. Who knows what purslane is? Yeah, purslane, if you eat purslane, it's like a lemony taste to it. But anyway, you got to make sure you've got, this is one of those toxic lookalikes that I was telling you about. Purslane. This is purslane at the top. This right below it looks very similar to it. However, yes, ma'am. It grows everywhere. Like it'll even grow in like concrete. It just pops up in the cracks of concrete. This one at the bottom is called spurge, and the way that you tell, you break the stem open. If you see a milky white substance come out, then you've got spurge. You don't want that. Okay, that's how you know. Now, to treat a burn, you can make an herbal oil, which I'm going to show you how to do that. You can make an herbal salve, a poultice, a tincture, or you can make a tea and you use that internally and externally. I put that internally because anytime you're trying to combat anything, go ahead and use it internally and externally. That way, you're getting it from both sides. You know, you're getting treated from the inside and outside. Who has made an herbal oil before? Yep. Awesome. Let's make one. So, who knows the difference between an essential oil and an herbal oil? What's the difference? It's close. It's close. There are some essential oils that you can ingest, but they are so concentrated. It's such a really high dosage that sometimes, it's best to just kind of steer clear of that. But essential oils, that is taking the herb or whatever it is. Like I've made orange essential oil. You taking that particular plant and extracting the actual oils in that plant. It's the oils that's already there. Now with an herbal oil, you're taking a carrier oil, which I will talk about here in a minute what carrier oils is. But you're taking an oil, you're putting the herbs into the oil, and it's like an infusion. It's sort of like you're making a tea, but you're doing it with, instead of water, with oil. And so you can, a carrier oil is any plant-based oil, olive oil, almond oil, coconut, avocado. I really like olive oil or coconut oil. You cannot use coconut oil if you're going to do it the cold way. And I'll tell you what the cold way is. There's two different methods that you can use to make an herbal oil. When you do an herbal oil, you must use dried herbs, because if you are going to put fresh herbs into an oil, there's going to be a little bit of moisture in there, and that moisture can make it go rancid pretty quickly. So you want to make sure you get all that moisture out. Just rub it on your skin as you need, and this will store for about a year. Now, if you add a little bit of vitamin E oil to that, it'll extend the shelf life. It's a natural preservative. All right, so there's two methods. There's one is slower and one is faster. Now, what I've done here is I have calendula flowers. I've just filled it up and I've put oil just to cover them up. Okay. This is the slow method. This will take about 6 to 8 weeks. A lot of people will do a lot faster. If you want to do 2 to 4 weeks, that's fine. I always leave it in for the full 8 weeks myself. Put it in, make sure you keep it in a cool, dark, dry place, and you make sure you kind of mix it up every single day within that 8 weeks. And you will have an infused oil, herbal infused oil. That's the longer way. I much prefer that way if I've got the time. But you can also do it with heat. So when you are using heat, it speeds up the process a lot. And I'm going to show you just how to make this. Now, you have a pot. Who knows what a double boiler is? Yeah, this is a double boiler. And you can put, if you have just another pot, you could put that in there. Bowl, yeah. Just make sure it's not plastic. That'd not be good. And so you've got water in here. And what I'm going to do is, I'm going to sit this down here because that's tile. All right. And you have your pot here. You have, let me make sure I've got, which one we're going to use. Let's use calendula here. Okay, so I'm going to put just water in the bottom of the pot here. And this is not vodka, this is water. Everybody. I've just reused the container. All right, so you have that in the pot, and I've turned it on, and you put this on top. What this will do is the water on the bottom will just warm this up, what's in here. All right, you have your herb, whatever herb that you're going to use, and you put this. These are dried, yes. This has got numbers on it, and I would say medium, yeah. And I'm going to put I'm not going to make a whole lot. I'm just going to make a little bit. So I'm just going to put a little bit in there. And then your oil. Now what this is a 1-to-5 ratio. So if you have 1 part of herb, make sure you do about 5 times that in your oil. Usually I just make sure that I cover it. Just cover it. So that's what I'm going to do. All right. And while that is heating up, I'll go on. But one thing you got to make sure to do, cover it. You've got to make sure you cover it. Because if you don't cover it, all those medicinal benefits are going to evaporate. Make sure to cover it. Do you have any questions about either method? Yes, ma'am. Do you ever use castor oil? I don't use castor oil. There's a lot of a lot of oils that I have steered clear from, just because of the way that they're being processed nowadays. Yeah, hexane, yes. Hexane is very flammable, very horrible. They process the oil, any kind of, like, let's say, corn oil, vegetable oil, all those oils that you can get in a grocery store nowadays are just really, really bad for you. And they strip it all out, all the good stuff out, and then they'll put other chemicals in to make the first chemicals to where it won't hurt our bodies. I mean, it's just basically just chemicals that we're ingesting. So if you could find an organic castor oil, you could do that. And unrefined, yes. Organic and unrefined, yes. Yes. Very good quality, yes. Unrefined and not processed.
Cold press?
Cold pressed, yes.
So one that you
I personally, for this demonstration, I'm using olive oil, but most of the time I like to use coconut oil. I like to use
organic, unrefined, cold pressed coconut oil ounces for like under $10.
But they have a better one in Costco if you can ever get there.
Okay.
Because it's extra virgin. There's some that are virgin and some that are extra virgin. Unrefined, cold pressed. I don't know if Costco still carries it, but they used to. It used to be a huge thing.
Okay. The thing that you got to be careful with, of course, if you're going to do the cold method, this is going to harden up because coconut oil hardens up. So you've got to use something other than coconut oil for the cold press. And with the warmth, when you're making it with warmth, the second method here, you can use coconut oil, you can use whatever type of oil that you get, but just make sure that's a good quality oil that you're going to use, something that's plant-based. Okay. Any other questions?
Vegetable oil is not plant-based. Well, they make it sound like it is.
Yes, that's true. Yes. Yeah, that I don't like to even bring that in the house. And one other thing I want to mention is extra virgin olive oil is best not to be heated. If you're going to use that, use just regular olive oil, not the extra virgin. Okay. Ooh, this got warm fast. Okay, so basically what I'm doing is it's off. It's off. The water is boiling over, that's why. I put a little bit too much water in it, that's why. Okay, so that's just cooling down now. It is off. What I would do is steep this. I say steep, that's what you do with the tea. Infuse this more, a little bit longer. What I would normally do is a little bit longer. I would go for about 30 minutes, but for the purposes of this class, I'm just going to go for a little bit of time. Now, for this, all you would do, all it's in here is just the calendula, the herb, and the oil. So I would strain this. Make sure you have something that you strain with that is specifically for all of your herbal things. You see, this is really stained, very, very stained. That's because I've used a lot of turmeric. Turmeric stains really bad. These are I only use this for herbal preparation stuff. I only use that. Yes, ma'am.
You need to watch your detergent.
Yes, detergents, yes.
Otherwise, it's going to go into your food. So it needs to be non-toxic.
Yes. You can use a cheesecloth, although cheesecloths are, I find that they don't really strain out as much. These are just linen cloths that are specific for this, but you can use an old t-shirt or something. But like she said about the detergents, make sure that, we make our own laundry detergent. Do you? Okay. And so, yeah, that's probably the best way to go. To get a lot of these stains out, I will wash it out real good in the sink, and then I will put it in boiling water and boil some of it out, and then I'll put it in and wash it. All right, so I'm going to strain this out, and basically all I'm going to do is take this, and I've got a strainer here, and we'll put this over the top so that it strains right through. Yes, wash it every time. Yes. And whatever container you're going to use, make sure that it is, if this is warm, don't use plastic. And really, you shouldn't be using plastic anyways. Plastic is leaching all kinds of things into systems, which shouldn't be there. So you take that and you strain it out. I'm gonna see if I can hit this spot right here. And so that is just going to strain right out. Oh, go ahead if you need. Yes, herbs and oil. Yes, everything.
What about a regular strainer with metal or stainless steel strainer?
You can use, yeah, that's what I've got right here. And you can do that. Although you're not going to, you may have a little bit of the herb go through, so it's not going to be as strained out. So then I'll just take that and I'll squeeze all of that out, all that goodness, and then you have an herbal oil there. Okay. It's not a whole lot. I didn't do a whole lot, but you can make as much as you need. And I'm going to press all that out as much as I can. All right. Moving on. Say what?
No, it'd take 30, normally 30 minutes.
Normally it will take a lot longer. I'm just, for the purposes, I sped that up a little bit. That's it. Yes. Yes. After the 8 weeks, all you do is just strain the flowers out, or the whatever herb you're using, strain it out. And you've got, yeah. Yes.
Those flowers that you strain and stuff, can you consume it, or you just have to discard them?
You can consume it. A lot of, if you do the specific time frame, a lot of the, the medicinal benefits are going to be in that oil. But you can, you can still, if you wanted to.
Or give it to your animals, or
Yeah.
Yep.
Compost. Yep.
Well, if you use a good natural unrefined oil, I mean, it's just
Yeah. And then I don't want to do that right now because it's warm, but you can take that and dab it on whatever you have, whatever issues you've got, and that's infused into that oil. Yes, ma'am.
When it says stores 1 year without vitamin oil.
Yes. Okay. If you're not going to be putting vitamin E oil in it, you store it in whatever container you're going to use, preferably glass. Preferably like a canning jar. That would probably be the best option. But make sure that it stays in a dark place. Okay, that'll store on your shelf in a dark place for a year. Now, if you put vitamin E oil in it, because it's a preservative, that'll last longer than that year. Okay. Yes. It depends on the type you get, but it's not much. It's just a tiny, tiny bit. It does not. You don't have to put a lot in there at all.
Do you have any recommendations for a good vitamin oil?
What is that vitamin? He can look it up. That's what we just bought some not too long ago. Okay. Oh, I always go the wrong way. All right, let's move on to bleeding. Now, there are different layers of the skin, of course, like what we talked about, the epidermis, dermis, and the subcutaneous level. And that subcutaneous is deep. And you can see that if you cut the epidermis, it's like a paper cut, it doesn't go very deep, but there's others that will go much deeper. Now, this is Thomas. Well, this is Thomas's hand. He was hiking in the woods by himself, and unfortunately he fell, and a tree limb slashed his hand open, and he was not around anywhere where he could get help. So he knew what to do, though. He knew what herbs to go and grab and put on his bleeding wound. Today, he continues to hike, and he barely has a scar. You can see where it has healed up. Now, some of those herbs that were used for bleeding, cayenne pepper. Now, you would not think cayenne pepper would be one. You have cayenne pepper. Let's say you cut your finger cutting some vegetables in the in the kitchen. If you take that, he's showing the vitamin E oil. If you take that cayenne pepper and you put that on there, yeah, it's gonna be a little zingy when you first put it on there. It's gonna burn, but cayenne pepper will numb that and it will stop the bleeding, both. So cayenne pepper is something that we use a lot. Yes, ma'am.
I read a story where they had a major wound and someone packed it with cayenne pepper, and then went to the hospital. They said whatever this person did saved you,
Saved their life.
because it closes the circuit in your body. It's like a tire when you open up like a hole in your tire, for instance. You know how you patch it up, and it flows. That's basically what's happening. It seals off the wound completely to patch up your entire system again. And it heals tremendously. And I've used it on my son. I've used it on my animals.
It works great.
It's
Works amazing. Yes.
I think that should be put in someone's go bag. Like
yes. Your bug out bag. Yeah.
Powdered cayenne pepper. I haven't tried it with any liquid. They had the hot liquid. It's very hot. That might work as well, like an extract type of thing.
Right.
But we've used the powder and packed them.
That works. Yeah, it works really great. Another good one is yarrow. This is yarrow up here, and the yarrow right here is amazing for bleeding. Did you know that prior to World War I, when a lot of the herbal medicines were really big on the scene, soldiers that were marching off to war, they would pack their pockets full of yarrow because they knew how good it worked for bleeding. Yes. That's why. That's because it works so good for bleeding. If they were shot or hit or something happened, they could pack that wound if they were conscious. The leaves and the flowers are really great. Now it comes in different colors. This one, this one's a pretty pink color. You see it in white, you see it yellow, different colors. Calendula, like what we used here, it's amazing for the skin. Calendula is amazing for the skin. Comfrey, shepherd's purse. I've got a picture of that over here. The leaves and the flowers. Now, comfrey, you got to make sure that you never, ever, ever put comfrey on a really deep wound. Make sure you never do that. Comfrey will heal the skin so quickly and so fast that it will heal the outside of the skin before it has time to heal on the inside. Okay, so keep that in mind. Never, ever, ever use comfrey on a deep wound, a puncture wound. Now you can use this. You can make these things into a poultice, a tincture, or a tea. A poultice, well, we will talk about that. I'm going to go into all of that, I promise you. So if you're going to use fresh herbs for bleeding, with some applications you can use fresh herbs. I have found a lot of, if you've already got some dried, I think that works really good too. Usually this will include the stems, the leaves, and the flowers, usually. And a difference between an infusion and a decoction. An infusion is using the stems, leaves, and flowers. A decoction is using the bark, the root, the more meaty part of the herbs. And you will have to, if you're going to use that to make an herbal oil or a tincture or whatever you're making, you got to do that longer. So keep that in mind. Let's talk about external infections. Does anybody have any questions prior to this? No? Okay. External infections, they're caused by pathogens that enter the body from the outside. You can get that from other people, bites, stings. Yes, ma'am. Yeah.
Does it actually have just the same sort of potency as the flowers?
It depends on the herb. Most of the time I would say yes to that. But it really does depend on the herb. Yeah. Okay. You can get that, you can get the external infections by many, many different ways. Okay, this is pretty graphic here. This is Carol. This is the top of her head. Yes. Carol loved working outside. She loved working in the garden, but she developed a cyst on the top of her head and it became infected. And she let it go too long. The sweat glands, because she was wearing a hat a lot. And so it got infected and it got worse and worse. And she went and she saw herbal treatment. Because if she went to a medical doctor in the Western medical world right now, what do you think that they would do? Graft, yeah. They would probably do a skin graft, and she wouldn't have her hair back. It would be she'd have a bald spot. But because she was able to do a poultice, you can see here, this is a poultice on the top of her head here. That healed, and now she has her hair back. Great. That's the amazing thing about herbs. So some of those herbs that you can use for external infections are calendula. Calendula is good for a lot of things, a lot of things, especially skin related. Plantain leaves, because plantain pulls things out. That pulls the infection out of there. Comfrey leaves in the root, yarrow leaves in the flower, but you can also use all these things as a poultice, a tincture, herbal salve, herbal oil, tea. Let's make a poultice. I'll show you how to make a poultice. All right, so this is if you're going to use a dried poultice, dried flowers or dried herbs. It can get really messy. It's commonly used for wounds. You just add a little bit of water to the dried herb. It's best to use dried powdered. But if you have other, that's fine too. You apply it for 30 minutes and you just apply it as needed for your particular wound. Now, I'm going to show you a little bit later how you make a spit poultice. But for this, you can see for this picture right here, all she's done, she's added a little bit of water and just sort of made like a little paste and put that on the area of concern. She just puts that on there. All those herbs will help heal it, pull out the infection, and it really does work. It really does. Yes, ma'am.
What if in an emergency you only have fresh plants? Can you just make like break it down really well and add? You don't need the water.
No, you don't. But at that point, you can do that. It'll be a little bit more difficult, but more than likely, I would do a spit poultice, which we will talk about here in a minute. Yes, ma'am. Oh, okay. Okay.
She used it before, that's why in an emergency.
Okay. That was a poultice. She used some of the I believe it was yarrow, comfrey. She used a lot of comfrey, although it was pretty deep. What she probably did was start with the plantain and the yarrow, and then as that healed, she used the comfrey. Yeah. All right, let's talk about wounds. Wounds can be anything from lacerations, cuts, abrasions, bruises, scrapes, scratches, puncture wounds, any of that. Each wound may need to be treated differently. Wade here, this is his foot. Wade was building an outdoor shed and he accidentally dropped the glass window and a shard of that went through his foot. Ouch. It shattered, it went through, the glass punctured, went through his shoe into the bottom of his foot. He was frantic, but luckily his wife knew exactly what to do. She had some herbal knowledge. She grabbed the herbs that was needed and started mending his foot. And today he is extra careful around glass, but he has no repercussions of the ordeal at all. Some of those herbs that are really good for wounds, the calendula, and that's in a lot, anything skin related, that's there. The yarrow, hops, comfrey, and the cayenne. Cayenne, there you go, that's another one. You can make that into a tincture, a poultice, or an herbal tea. You should never, ever, ever use comfrey on puncture wounds. I can't say that enough. Yeah, that looks pretty gross, right? That looks painful. Let's make a tea. Now, a lot of people will make herbal teas, but they don't make them correctly. I'll show you how. You can, of course, like what I was talking about, the infusion or the decoction, whatever you're using, the stems or the flowers or the roots or the bark. You can use fresh or dried and powdered herbs, but you must cover it. That's the thing. You must cover it because you don't want that the medicinal benefits evaporating out of that tea. So you got to make sure you cover it. Of course, you can make the tea and then add sweetener, whatever you like, honey, sweetener, whatever. We grow our own stevia, so that works really good. Now you can do, this is another one that's cold brew or one cold or hot method. So a lot of people don't do the cold method, but it's possible. You have your cup, you put your herbs down in there, you cover it with water, stick it in the refrigerator for 24 hours. Simple, right? And just strain those out and drink it the next day. No, because you're not using heat. Yeah. Now, if you are using heat, of course, you got to cover it. Now, with this one, that's still a little warm. I'm going to put it down here. This is the only thing I've got in here is water, and I put some lemon balm in here. Now, if you're going to make a tea, I'll tell you a good one is anybody here ever had basil tea? It's good. It's good. Basil tea is good. So you put the herbs in there, put the water in there, and you bring it to a boil. Make sure you cover it. Yes, ma'am. I probably wouldn't do that. Yeah, if you're adding oil to the water, of course, it's not going to last very long if you're going to want to store it. If I'm understanding your question correctly.
Well, I know I have like edible basil oil.
Probably no, because oil and water separate. So I'd probably say no to that one. All right, so you bring this to a boil, and all that's in there is just the herb and the water. And then you steep that for 10 minutes up to 2 hours. Steeping just means it's sitting there. It's in there. Yeah. Yes. Turn it off. Yes. Yes. Bring it to a boil and you turn it off. Well, if you're going to do, let's say, a bark or something that's, it's going to take a little bit longer. Yes. Yes. Yes.
Is it longer better? Or can you oversteep?
I wouldn't go over 2 hours, but I tend to do everything to the fullest extent. Yeah, I tend to do that. Now you could do this by using the stovetop with the pan like this, or if you just want to boil water and put it into a cup, you can do that. You can use a French press. Does everybody know what a French press is? Yeah. French press is great because it will steep it because it's got a lid to it, and it's got yes, yeah, you strain it, you push it down and it strains it all in one. Love French press. Yeah, they're easy. But once this has steeped, and let's say it's been going for the 10 minutes, all you would need to do, this has been setting in there for a little bit longer, so just cold brewing. You would strain this out, and what I'm going to do is if anybody wants to taste lemon balm tea, I have cups here. You'll have to let me know. I will strain this out, and you want some? Okay. All right. Let's make sure I don't make a mess here. Don't know how much is in the cup. Okay, that has been strained out. And I will give this to you, and I will give this in case you want any type of sweetener with it. Anybody else want any? Yes, okay.
Oh, thank you.
Okay. Alrighty. Yeah, oh, sure, if you want to. Thank you. I appreciate that. Thank you. I just don't want to burn you. It is a little warm. Let's see how much is in the bottom there. So, let me give you some sweetener too. Oh, you don't? Okay. Oh, yeah, I got it. Thank you. Okay, who else was wanting some tea? You was- Okay, anybody else? Okay, I'll get you some.
I could give him some of mine. Just give me a cup.
Okay. Basil tea is really good for digestion. Really good for gastrointestinal. Anything that you are having trouble, if you're having any kind of trouble with digestion, it's really good for that. It's basil's good for a lot of stuff. Yes. Yeah. It can. Although I would say echinacea is the better one for that. Yeah. Echinacea has a natural hyaluronic acid in it, and echinacea, like if you are bitten by a snake, it is imperative that you get the echinacea root and you put that on there because it will stop all of the, like it eats away at your skin. Let me give you an example. Okay, let's say the a brick building. The bricks are your cells, and the mortar in between the bricks is the hyaluronic acid. When you have a snake bite, it eats away at all of that hyaluronic acid in between. And so you're just left with nothing. Sometimes they'll have to either amputate or you lose your life. So if you put that on there, it stops it. Yeah.
So does it draw it out? Is the purpose to draw out? Like, what is a natural kind of thing?
A natural thing to draw out like poisons.
Yeah, what echinacea does.
You can use echinacea for that, but plantain is really good for drawing out. It just stops the melting away of that hyaluronic acid. Yeah.
And that's good for echinacea is that hyaluronic acid. That's good for your skin.
It's good for your skin. Yeah. You see a lot of that in the cosmetic world now, the hyaluronic acid, but echinacea is natural. So, yeah.
One thing, when she says that multiple herbs are helpful with things, like if you were getting a snake bite, you would probably want to have like a combination of plantain.
Because that draws.
Yes.
Yeah.
That's
Yes.
why I was asking. What do we
Echinacea,
want to
like
do with
all
it?
together,
Yeah.
and you can combine herbs together.
Yes.
You don't have to do one single herb at a time.
Yeah. If you're going to make a tea or oil or anything, you can do multiple herbs at one time.
Yes. Yes.
Yeah. The plantain would draw out the poison. The echinacea would stop the hyaluronic acid from melting. And then after all that initial part, I'd put probably comfrey on there. It would heal it really fast. So yeah.
But only on an open wound. Have to wait.
Well, if it's really deep, I wouldn't use the comfrey. But if it with a snake bite, it would depend on the snake, I guess. Depends on how big it is. But yeah, comfrey's a good one. It will actually heal broken bones. You know, that sounds weird, but it will. It sounds silly, but it will heal broken bones. It has what they call allotonin in it, and allotonin will seep deep down into your tissues, and it will mend the bones. Yeah.
In other words, you would put it on as a poultice, all three with water.
That or make a tincture, spray tincture. We'll talk about. Yeah. Any of those.
Snake bites, you
A snake bite, yes.
mean? You're
Yes.
talking about making tincture?
I would probably
Poultice would be
do
better.
yes. I would probably do a poultice. That would be the best. Go ahead.
The broken bone, you're really just letting it seep into that area where your broken bone is, and it would go into that and over.
Exactly. Yes.
Wow,
Yes. Yeah. Yep. Now, not for a snake bite, but for other things, you can make a tea like this and use it externally. You know, dip a towel or something down into it and just put it on. You can do that too.
Is that just a wound?
You can put it on wounds. Yeah, you can any kind of anything
Wounds,
topical,
rashes.
abrasions, cuts, yeah, anything like that. Although I would say, like you said, the poultice it would penetrate better. Yeah. Everybody still awake? Anybody fell asleep on me yet? Name one of the herbs used to treat burns other than aloe vera. There you go. Yeah, calendula is a good one. Anything topical, it's usually got calendula in it. Let's talk about pain. So no two people feel pain the same way. Pain is felt when signals travel through the nerve fibers to the brain. It can be acute or chronic, and it could be somatic versus visceral. Now, you could read here what the difference is, but the point I'm basically trying to make is everybody feels pain differently. April. Now, this is a major story here. April. She was in a car accident. She was given 10% chance of survival because the car accident was so bad. She broke 28 bones, including her neck, skull, spine, arm, pelvis, ribs, fingers, legs, arms, and hip. Ouch. She was also burned from the gasoline fire. The car caught on fire. She was burned on multiple areas of her body. All the skin was torn off of her right forearm. Can you just imagine how bad that was? That gives me goosebumps just talking about it. Both lungs were punctured. She spent 8 months in the hospital, and 1 month of that was in coma. She was in a lot of pain. But she didn't want to get addicted to prescription medications, so she turned to an herbalist for help. And she began consuming herbs and using those topically on her burns. 6 months with herbs. 6 months. Can you imagine if she had went just the normal route with the medical field? That would have been a lot longer.
She would have never healed.
Exactly. Right. 6 months. She got her life back. Today she's a nurse and she's working without any pain. She's back to normal.
Yeah.
Allopathic? Yes, yes. Right. Yes, yes. Okay, so some of the herbs that are used for pain. American skullcap leaves. That's good. Hops is good. Cramp bark. Cramp bark is good for any kind of muscle problems. Teasel is really good for any nerve problems. White sage, you got to make sure you use Salvia apiana. You got to make sure the Latin name is correct. The Latin name, you got to go by that, because let's take echinacea. For we were talking about echinacea. There's all kinds of different echinacea. Echinacea angustifolium. There's all different types, but the really good medicinal one is the Echinacea purpurea. That's the Latin name for it. So a lot of herbs you need to make sure you have the correct one, and you do that by looking at the Latin name. And willow bark is nature's aspirin. Now let me throw this in here. Hops and white sage. You mix those together, maybe add in some wild lettuce. Those two mixed together is the same pain relieving effects as marijuana without the high. Just saying. And it's legal too. There's different Latin names for the different types of echinacea. Yeah. But and they all have different medicinal properties. But the one that I use a lot is the Echinacea purpurea, which is the official echinacea. Yes. There are, but see, throughout time, things have, you know how you see what's the hybrids? That's the word. Hybrid things. Yeah. Things have just gotten pulled in every direction. So if you go back to the original, the main one. Yeah. Yes, ma'am. Hops, white sage, but make sure that white sage is the Salvia apiana, because there's a white sage. There's other types of sages, many other different types too. Yeah, those two, and I would probably throw in wild lettuce. Wild lettuce is good. We grow wild lettuce, and there's a white milky substance in the middle of it that is the pain relieving effects. It works amazing on headaches. Works amazing on other pain things too.
You could eat it like internally.
You can eat it internally. It's a little bitter, but you can. But what I typically will do is make tinctures, because if you make a tincture correctly and you store a tincture correctly, it will last indefinitely. So I like to have that medicine on the hand for pain. Well, you can use it topically if you're going to, or a tincture under the tongue. Yes, yeah, it comes with a dropper. Yeah, so you can use it internally or externally.
When it comes to tincture, if you're looking to buy some at the store,
there's a huge difference if you buy a tincture at the store. Actually, let me get into that when we talk about tinctures. Yeah, there's a big difference. Let's make an herbal salve first, though. In order to make an herbal salve, you have to make the herbal oil first. So you have the herbal oil already made. Okay. And so with this, I'm setting this on the floor because it's tile and this is warm and I don't want to mess up the table. With an herbal oil, You've got to use dried herbs. You've got to use that. Like I said before, the moisture in that can make that herbal oil go rancid pretty quickly. But if you already have the herbal oil made, all you have to do is add beeswax. You got to make sure that you purchase beeswax if you don't already have bees on your homestead. We have bees on our homestead. But if you purchase beeswax, you got to make sure that it is good organic beeswax. Sometimes even they'll put on the packaging organic and they'll say it's all natural, and it's not. So you've got to be really careful with that. You've got to do your research. Unfortunately, yes.
Well, unless you have tons and tons of bees, being a beekeeper,
Mhm.
it's like, they'll go to neighbor's yard, you don't know, they go like 10 miles out.
Yes. Yeah.
And so if you're in a neighborhood, like you can round up and,
Yeah.
you know, I mean.
Not good.
You don't really
Maybe
know.
even use your own, you wouldn't know.
That's sad that in today's world that it's like that. You just don't know. Yeah. We have bees on our homestead. Yes. It all depends on price, and it would depend on company, and all the research. I do a ton of research on.
So what do you do if you were going to buy beeswax?
That's a hard one. It's a hard one because just like what she said, you just don't know, because those bees, even our bees on our homestead, they can travel 10 miles away. And if our neighbors 10 miles away are using Roundup or anything,
You've done a lot of research already,
It's been so long since we bought
Oh, okay.
beeswax that, you know.
yeah. So basically what I've got is the double boiler that I used before, and I'm going to pour that back in there because I've strained it now. It's all strained. And then I'm going to add beeswax. This is another one that is a 1 to 5 ratio. 1 part oil, or 5 parts, or sorry, that was backwards. 5 parts of the oil to 1 part of the beeswax. So I didn't do a whole lot of, I'm just going to eye this for now. You can always measure that if you want to. So yeah. And then you put that in, and all you're going to do is just heat it just enough to melt it. Okay. I am still going to try to make sure to keep all those medicinal benefits inside, put a lid on it, but all I'm going to do is heating it just enough to melt that beeswax. Of course, you can just dab that onto wounds when it's needed. You can add the vitamin E oil if you've not already into while it's going right now, while it's warm. And then you have a salve. Once that beeswax is melted, put it into a container. Now, of course, obviously, don't put it into plastic. But you can, they make these here. I prefer glass. Glass is my go-to. They make little jars, little tiny jars. Glass is, I would say, the best one to go. This is aluminum. Aluminum's not good for the skin. So, but you'll see this a lot in, salves that you purchase a lot. But glass is my go-to. Any questions on making a salve? Okay, so once this has heated up, actually it's just about heated up now. It doesn't take very long. And once that's all melted, then you just pour it into your container, whatever you're using, and let it harden up. It hardens up, then you have a salve. Depends on if you use vitamin E oil or not. Same. Yeah, a lot longer if you put the vitamin E oil in it. Yeah. All right, let's talk about shock. Now, shock is life-threatening. A lot of people don't think that shock is that bad, but it can be. The body doesn't receive enough blood flow, and it's very damaging to the organs and cells. This can be caused by uncontrollable bleeding, severe burns, spinal injury, heart problems. Anything that's just a big shock to the system can cause shock. There's different stages and different symptoms. Everybody's different, just like with pain. Now, this is Peter. After being involved in a car accident, Peter went into shock, and his heart was racing. It started to rise, and he was breathing really hard. He began to shake uncontrollably. I've been there. I was in a car accident, and I couldn't stop shaking. An elderly woman, this happened to be on a street with houses on the side. An elderly woman was watching this whole ordeal, and so she came out of her kitchen. She knew the signs of shock. She went straight to him with her walker and everything, walker all the way out to him, and she dabbed some cayenne pepper on his gums and his lips, and the shock went away. It only took seconds, and he came back to reality. So,
and it's actually really good for animals. Like, animal just gave birth, and the newborn isn't necessarily breathing, or
yeah, you dab some on their gums, and it just brings them right back, just like that.
So that's probably for us the most shock system that we've had on our own set is dealing with that for animals. And we always have cayenne pepper, especially when we're expecting a birth.
Yeah. Yes.
I was doing
Mm-hmm. That's a good thing. Apple cider vinegar is good too. That's good for, especially if you have GERD or any type of acid reflux. Apple cider vinegar. Yeah. Yeah.
Cayenne pepper will help blood pressure regulate.
Yes.
If you have high
Or low. Yeah, either one. Yeah, it's hard. Yeah, it's fine. And it also helps with if you think you're having a heart attack, cayenne pepper will help with that.
Take you out of a heart attack.
Yes.
How potent.
Yeah, it will take you out of it.
So you could just like put it right in someone's mouth if they have to take them out.
Yeah. Cayenne pepper is good. Is a good one to have on hand, for sure. So cayenne pepper is emotional and for physical trauma, mostly. Arnica is one that you can use for the same thing. You don't hear a lot about arnica. Valerian is more of an emotional trauma. Valerian is good for sleep. It calms you. And so that's a good one. And especially if you suffer from any type of anxiety, valerian is a good one to have. No. A lot of medical doctors don't really, they don't understand herbs. You know, they're not trained in it.
They're
So,
not paid
yes.
in herb. They're
Yeah.
not paid for the herbs. They're
Yeah.
paid for the drugs.
Mm-hmm. Melatonin? I'm not sure about that. I don't
Yeah, you
know.
can get it in prescription. You can basically get any pharmaceutical prescription. But
It's not as
no,
effective
not
either.
valerian.
No.
Because remember, what they had doesn't cure. It will never cure. And they make sure of it.
So what you're buying in the store though, if you were to get a prescription now, it's gotta be better than the store buy.
Well, I don't know. Any pharmaceutical medications are they basically take a little piece of an herb and they'll package all these toxic chemicals with it, package it up into a pill and sell it. And so they're making profit off of something that you can get for free, basically, and a lot better for you. Herbs are.
Whatever you say, can you get it like in one of these?
That one I'm not sure about. You could try. I know that if
I order a lot, but I didn't realize.
okay, Oh, okay. The valerian. Yeah, it's good. Really good for sleep. Valerian is good for sleep. Yeah. Yeah.
I'll have to look it
Okay. And skull cap. That's a good one. It's good for pain too, but it's good for emotional trauma as well. So you can make a dried and powdered herb and just make that and put that directly into the mouth, or you can make a tea or a tincture. So with the dried or powdered herb, it's best to wait and grind that right before you're going to use it. Like I said before, right before you use it, grind it up and put it into soups, stews, sauces, things like that. Or you could just down it. I mean, it's not going to taste that great. And you could put it into capsule forms as well. You can make your own capsules. They do make a capsule machine that yeah, it's real easy. I brought one, but this is what we have. It's called a capsule it. And basically you just have the powdered herb, and you put all the bottoms of the capsules in this machine, and you put the herb in there, and then the machine goes down and you put the tops on it, and then you have capsules. Well, that one will do, I think it's 100 at a time. But
Or does it actually, the potency when you capsulate it, or you said you want to grind it and then you make them?
yeah, I would use that within, say, 6 months or so. Yeah. But you have to be careful if you're going to use capsules. You got to make whatever you're taking it for. Let's say you are going to take it for, let's say you have a sore throat. Okay, that's probably not going to be the best route, because let's say you have a gastrointestinal issue. Okay, that capsule is going through your system. It's not that the actual capsule itself is not going to disintegrate in your body until it gets down to your colon. So, think about that. If you're going to take it for something down here, yeah, it's probably going to help. But the best route would be the other ways: teas, tinctures, things like that. All right, poison. It can be inhaled, ingested, through your skin, through animal bites, anything like that. Okay, so the story is about me this time. All right, so I'm highly allergic to bees. Highly, highly, highly. I've had to carry around EpiPens before, prior to me knowing herbal things. And because we do have bees on our homestead, I get stung quite a lot. But I never have to go to the hospital anymore. Before it was severe anaphylactic shock. It was not good. So I don't have an allergic reaction anymore because I know what to do. And what I do is I use plantain, and I have plantain right here. Who knows what plantain looks like? This grows almost everywhere. This is just a bigger leaf of it. This grows everywhere. It's everywhere. It's just everywhere. You probably, if you walked in grass today, you probably stepped on some. Yeah, this is a very large leaf. It's usually a little bit smaller than this usually, but yeah.
Do they grow out like to the side?
They'll grow up to the side if you let them grow, and then they'll have little spikes that grow up. Do you know what psyllium husk is? It's like a fiber supplement that you take. That's what that is. The spikes that come up, the seeds in that is psyllium husk. Yeah. And so I know how to use this, and I'm going to show you how to do that here in just a minute. But some other ones that are good for poisoning is lobelia, bayberry, and vervain. Now, this will induce vomiting. If you've ingested something that is bad, you can use these herbs through a tea or a tincture. Now, if you have something like a bite, a sting, something like that, you can use an herbal tea, or I'm sorry, herbal tincture or poultice by using dandelion root, echinacea, marshmallow, or plantain. The root, yes. Usually, other than for this purpose, usually dandelion leaf is good for the kidneys, and the dandelion root is good for the liver. The flower, you can use the flower too. It's more for like leaf, kidney. Yeah, any part of dandelion is edible and medicinal. Yeah, yeah. You can. You can make dandelion tea. You can saute up the dandelion flowers and put them in a salad. Yeah, yeah. Yes, usually the root is for the liver and the leaf is more for the kidney. Yeah. A dandelion will help increase urine. So if you need to try to get something out of your body, yes, yes, diuretic. If let's say you have gout or something that you're just trying to get rid of, eat a lot of the leaf, and I will just yeah. The leaf, the dandelion leaf, yeah. Kidney, yes. Yes. Celery seed, celery root.
There was a point when nothing helped and we tried all of it and nothing. That's why I don't know if we tried a dandelion. The
Leaf and the seeds or the roots of celery is also really good for the gout. Yeah. Root is for the liver. It's more for the liver. Yeah. The detox for what are you referring to? To cleanse your body. Yeah, if for anything, if you have gout or you have anything that's in your body that you're trying to get rid of, dandelion leaf. Yeah. Yeah. So let me show you how to make a spit poultice. This is one I'm not really looking forward to, but I'm going to do it for you. All right. Ooh. So let's say I just got stung, and let's say I got stung on my arm, and I need to know, I need to immediately make a poultice, make a spit poultice. I'm going to go and grab the plantain, just grab it out of the ground. I'm going to take it and I'm going to chew it up and spit it out. Okay. It's very bitter, but I'm going to do it.
I didn't think you could eat plantain.
You can. You put it in salads. And the younger the leaf and the earlier in the spring it is, the better they are. They're not as bitter. All right, so this is called a spit poultice. And I'm sorry if I've got green stuff in my teeth all day. This is called a spit poultice. You don't have to do this, but what I typically do is grab another plantain leaf and throw it on top of it to cover it. And you keep it on there for about 30 minutes, 20, 30 minutes. The very first time I ever did this, I was amazed. I really, truly was. I had that on there. I pulled that off. And I'm thinking, where was I stung? I couldn't even tell where I had been stung. It pulls, plantain will pull the stinger and the poison out. It's really amazing. Plantain is great for that. And so because of that, because I can immediately go and put that on there, I don't have an allergic reaction anymore.
She was able to save someone from the hospital.
That's good.
We had a congregation picnic out at the park, and she said it grows everywhere.
Yes.
And he got stung on the back of the neck. Oh, he was starting to swell, and his wife is like, "Oh, we gotta go." Like, give me just 10 minutes. And I did that, and when we took it off, same thing. Everybody was like, they were shocked.
They were shocked.
We do keep a tincture form.
Yes.
Because I've been stung on the top of my head.
And that's really hard, especially with hair like me.
Doing
Thick hair.
Yes.
It's hard to do a poultice up there. Yeah.
Tincture with a spray,
we'll get right down.
You can just
Good.
spray
To
it,
it, yeah.
and you know
Right.
it's not quite as effective. Like I would be concerned using the tincture spray on her more so because she's highly allergic than me.
Well, can she take it internally too?
Yeah.
Mhm.
Internally and?
Internally in,
Okay.
yeah. Yeah.
That's good.
Yep. Yep. So you just basically just make a paste, slap it on there. Yes. Ow.
And my boyfriend came up to me. Oh my God. Suck that sucker right out of there. I mean, it was gone. I was like, I couldn't believe it. I'm like, oh, shit, you're gonna have to. And he was like, oh. And sucked it out. I was
That's
like,
quite a story.
"It's gone." I was sucked it out. I'm like,
Right.
yeah. I mean,
Yeah.
like, oh, I already know her.
Any questions before we move on to asthma?
I found it right there.
Okay.
1 minute, I'll find it.
Asthma is caused by inflammation and muscle tightening around the airways. You can have coughing, wheezing, chest tightness, shortness of breath. Any of these symptoms can happen, but they can be different severity. Yes, ma'am.
I've recently learned that asthma is dehydration. Salt water. But basically, if someone is having an asthma attack, they need to be completely hydrated with a little bit of salt on their tongue and then drink water. Oh, really?
Gumweed is really good for asthma. Gumweed. There's other ones too, but yeah, gumweed is a good one. So this is Mariah. She was a healthy woman in her 40s, and she had never had asthma problems before. Her dad had had problems before, but herself, she had never had any asthma problems. But thankfully, they were out. She was with her father. She had started having asthma where she just could not breathe, and her father knew what to do. He found some lobelia. He rolled it up in a leaf, the leaf into like a little straw. He lit it, and she smoked it. You would think because it's lungs, you don't want smoke there, but it actually helps. Lobelia, mullein, elecampane, all of those are really good for the lungs. Really, really good. It has different flowers, but a lot of these are landscaping flowers. You know, they're beautiful. You would never know that you've got a pharmacy right there in your yard because it's just really pretty flowers, you know. So in order to treat asthma, gumweed, like I talked about just a second ago, Brigham tea, that's also known as Mormon tea. You normally will find it more under the Mormon tea label, but mullein, lobelia, boswellia. Boswellia is the same thing as frankincense, by the way. Black cumin, ginseng, garlic, turmeric. Turmeric is one that every time you take turmeric, you need to make sure that you take black pepper with it because it will help get it to where it needs to go in the body. Now, it's got to be freshly ground black pepper. It cannot be what you buy already ground up in the store. Yeah, got to be freshly ground black pepper. Like you, you know what? Yeah, okay, yeah. You can make a herbal tea. You can make an herbal tincture. You can smoke the leaves. Any of these good. You can't, not the gumweed. Gumweed's little teeny tiny flowers, but. All right, so let's make a tincture. Anybody want to make a tincture? Yes. Yeah. You could, but it depends on the severity of the asthma as well. Yeah. Tinctures, yes. Tinctures are hard to explain, but I'm gonna do my best. Who knows the difference between a tincture and an extract? Okay, so an extract. You use apple cider vinegar, glycerin, water, all of these other things. Not alcohol. Not alcohol. But I'll explain that here. I'll explain it. Extracts are anything other than alcohol than you're using. A tincture is using only alcohol. Now, this is what he was talking about earlier, is in the store. You may go to a store and it says tincture on the bottle, but look at the ingredients. If it has anything other than alcohol and the herb in it, then it's an extract. It can have water, the herb, and alcohol, but that's still an extract. Extracts are not going to last very long. It's not going to last on the shelf very long. Tinctures, if you make them and store them correctly, will last indefinitely. Yes. All right, so when you're making a tincture, you've got to use at least 80 proof alcohol. Now, this can be vodka. Vodka is usually the cheapest, but it can be any other. Make sure it's at least 80 proof. If you are going to use roots, bark, the harder parts of an herb, you need to use something a little bit more stronger. Everclear is a good one. Yeah, Everclear is strong, but it will work. It'll pull those all the medicinal benefits out of there, out of the bark and everything. Okay, so the benefit.
Does it need to be organic?
You can do the cheap, as long as the proof is nothing under 80 proof.
Yes, nothing under. This is the cheapest that we can find. This is Dobra. This is just the actual. It's just the cheapest vodka, but it is 80 proof though. Alcohol. Yeah.
And if you use Everclear, where it is like for bark or like willow bark, you're making your natural aspirin and stuff, because it is so potent and awful tasting, or in my opinion, awful tasting. We will actually have a big batch, but then we'll put a smaller. If for some reason I need it, into a smaller bottle, and I'll add water to that, and keep my, to sort of make it. But that will diminish the usage for. It's only good for like 2 or 3 days until it goes bad. But for I just need it storage. I keep it in Everclear. Don't add water. Don't do anything, and then I'll pour as needed into a smaller thing and water it down for a little bit so I can actually handle it.
Well, even with 80 proof, tinctures taste bad. They really do. They just taste bad. Some are even worse than others, but it's a much more concentrated form. So you may have to take 10 cups of tea and 1 teaspoon of tincture to get the exact same medicinal benefit. Yeah. It's very concentrated, yes. That's the benefit of it, because you just take a lesser dosage. Yeah. You just put it under your tongue, and you let it sit there for 30 seconds, if you can. That's the best way to take it, because it gets into your bloodstream and it gets going quickly. Yes, I know it's hard. It is hard. Now, if you are taking a lot of them at one time, the bottom of your tongue is going to get a little raw. So you can put the tincture into a little bit of liquid, just a little bit, and down it. That's the secondary way. The best way is right underneath the tongue. Let it seep in. It's a 1-to-5 ratio, and I will show you that to you. Yeah, I will. Yeah. Of course, like I said before, you could do this tincture internally or externally, and it takes 6 to 8 weeks for completion. Some people will do 2 to 4 weeks. I always go the extended amount of time and do 8 weeks. That's just me. And do not use blue bottles. A lot of people, I get that question a lot, but don't use for looks, I guess. I don't know. Yes. Yes. Yes, there you go. Yep. These are amber bottles that blocks the light from going in because light can denature it. Now there's two ways of making a tincture. There's the folk method and there's the ratio method. The folk method, it's faster, sort of, in a way. It's faster to make, to prepare. But the bad thing about it is each batch may be different. When you're doing the ratio method, you get a more consistent tincture. Every batch is going to be the same. All right. I will show you what I mean by all this. Who's still awake? Anybody? What herb do you not put on puncture wounds? Yay, there you go. Ding, 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 you win. Oh, let's not go that far. I went back too far. Okay. Let me show you about the folk method. Now, what I do is I grab, let's say, a canning jar. With the folk method, you will put the herb in there, and then you will just cover it with your vodka. You just cover it. Now, you may have to add a little bit more vodka later on because it will, all of that will seep in, and you just gotta make sure that the alcohol is covering it all the time. Every day, you just take it and you flip it upside down, make sure it gets just like with the oil here, just like with the oil. Make sure that you keep it in a dark place. Now, with a canning jar like this, you got to keep it in a dark place. You can use something like this and just leave it out on your countertop. I like doing this because if I put this in a cupboard, I forget about this. You know, this right here is setting out and it reminds me. However, you can take a towel and wrap around it and do it that way. Same thing, basically. But just make sure it's in a cooler place, not in direct sunlight, not direct heat. So you could do that. That is the folk method. It's really easy, pretty simple. Just fill it, make sure it's covered with vodka. 6 to 8 weeks, yes. Now the ratio method is a little bit, there's a little bit more steps here. However, you get a more consistent tincture. The pro is that, of course, everything is going to be the same. Like if you're going to make a pain tincture, it's going to work exactly the same every time. So that's a good thing. It does.
Yes, you can.
It is possible. Yes. All right. I keep trying to go forward here. All right. So here, with this one, you have to have a scale. On the scale, let me turn it on here. Let's say you have your jar. And you're going to tear it out to make it completely zero. You put it on there and it says 0. Now you can use ounces, you can use pounds, you can use grams, you can use any unit that you have. I typically like to use grams. Grams are the best for me because that I use a smaller dosage of things. Now, if I'm going to make, let's say I want to make a plantain tincture. I am going to, since it's tared out, T-A-R-E, does everybody know what that means? Okay. Once that is completely at 0, I'm going to put, let's say I'm going to put 5 grams in here. So I'm going to weigh this out. And it's by weight. Oh, I'm right at 5. Oh, well, that's good. First try. Okay, so it's a 1 to 5. Or 1 to 5. So what you would do is you've got 5 grams, you multiply that by 5. So it's 5 parts of this to 25 parts of the vodka. So This says 5 grams right here. So I'm going to tear it out again to make sure it's at 0. And then I'm going to add 25 grams of vodka. Oh, I don't know how I'm doing that every time I get that exactly. It doesn't seem like a lot. No, and especially with plantain, it will really absorb that. So with plantain, sometimes I will have to do a 1-to-10 ratio, but most things are 1-to-5. And so it needs to be, yeah, it does. This one, because of how it looks, I am going to do a 1-to-10. So I'm going to actually add 25 more grams to that.
So if you're doing like 10 or 15 grams, you just times that by 5 for the vodka?
Yeah. Yep. And of course, it's the exact same way. You put a lid on it and you make sure you label it. I found that this masking tape works great on jars to label things. Put the date on it, and then you make sure to turn it every day for the 8 weeks, and make sure that you put this around it to keep it out of in the dark. No. Normally, without anything other than plantain, I don't have to. Yeah, and if you add more, it's going to mess everything up after the fact, you know. Yes.
You just got at the end, basically, after 8 weeks, you'll
Strain it,
drain it out and squeeze it. And, you know.
Yeah.
Would you want it to? That's what anyway, I'm sorry.
Yeah. No, you're fine. Now, before, you noticed I was using these stainless steel things. With a tincture, you need to not use stainless steel. Don't use a spoon, and you got to make sure, because the stainless steel, you got to make sure these lids that you use are not these lids, because that will mess up the tincture. You can do like what I've done here. This is an actual tincture I've got going right now. And they do make these covers that you can put on it. This is actually for a half-gallon jar, but this is a pickle jar I've used here. You can reuse jars. This is for immunity. And so I'm just, make sure I shake it up. But as you can tell, underneath the lid here, I have parchment paper. If you put parchment paper underneath there, it's going to keep that liquid from hitting that the metal lid. What's in the bottle? All different types of herbs. there's many different herbs in there, but this is to boost the immune system. And so, yeah, I just make sure that I mix that up every single day. If you've got these covers, that's great. If not, just put your cover around it like this. You don't want that exposed at all. That's why I'm making sure it is covered here. Make sure you label it. I always label the date that it's done. If you don't want to do that, you don't have to, but you definitely need to put at least a date on it to make sure that you know when it's done, because this was done on 7/21. 2 months ago, I would remember that. In July, I would forget that. So yes. So once that is done, after that 8 weeks, you strain that out. Use these again, but make sure that you don't use the metal strainers here. You strain that out. Now, they do make these funnels that are really great for these tincture bottles. Make sure this is not metal as well. Strain that out, put this in here. Now, this one is for consuming internally because it's got a dropper. This one here is for external use because it's got a spray top. This is what he was talking about with the plantain. If you make a plantain tincture and let's say you got stung on your head, just grab that and spray it real good. And you've always got medicine on your shelf. If you store that in a cool, dark, dry place and you make that properly, you're set. You've got medicine on your shelf for indefinitely. Yeah, isn't that cool?
When it comes to one of five, I've only found, and that's homegrown herbalist that actually sells pure tinctures.
Yeah, if you go on
Most
places
of them
like
will
Amazon,
add glycerin or water or other things other than alcohol or it's
Yes,
money.
you keep buying
Cost
from them again.
alcohol is the most expensive
never
part.
gets bad.
Normally.
Then they don't have to ever sell it again. They usually cure them.
yeah, yeah, and so you know you can get. I do want to mention that glycerin. That's not really good for your teeth. I know a lot of people will use that to make extracts, but it's really not good for your teeth at all. It's really not. It demineralizes the teeth. But anyways, we went through that one. You can treat health concerns in times where you need to. You just need a basic understanding of herbs. I hope I've shown you a few little tips and tricks here about how to make teas and herbal oils and salves and poultices and tinctures and all that good stuff. Grow these herbs. If you've got the space in your yard, grow them. Have them available. Have a pharmacy in your yard. If you can't grow them, purchase them. Go to use that specific link on my card if you want to go through the Homegrown Herbalist and purchase that. They're really great herbs, really, really, truly are. And, have them, grow them, purchase them. Just make sure you have this knowledge. Even if you don't use it for yourself, maybe your family, maybe your neighbors, maybe your animals may need this knowledge. Maybe for knowledge for them. Or maybe you might have to barter your knowledge in the future. You just never know. So start your own medicine cabinet and get prepared. Here is all of the stuff that I've got these books if you are interested in any of these other books. Of course, you've got these books here in front of you, and they're also available on Amazon, Books A Million, Barnes & Noble, all the major bookstores. And I do have another book coming out very, very soon. I cannot wait for it to come out. I am in the late stages of it right now, and it's going to go through so many good things. Everything in your body, everything like your cardiac system, your respiratory system, everything. If you have, we talked a lot about gout just a moment ago, or heart attacks, or headaches, or whatever ailment it is in your body, I'll go through and tell you exactly what herbs you can use, how to use them, and why to use them. So that one will be coming out soon. Okay, so I got one last question for you. What is the name of my website? You can sign up for bi-monthly herbal emails. Yes, awesome. A+ for you. All right, here's all my information. It's also on my cards, which I've got right up here. If you want my cards, they're here. Or if you want to sign up for the bi-monthly emails, where I'll put you in manually, you can sign up for that over here. Thank you so much for attending. I really do hope you got some things out of it. Thank you.